frequently asked questions. My name is Dr. Julian De Silva. I'm a London-based oculofacial and plastic surgeon. And a common question that I get asked is, should I be concerned about the scars from facelift surgery? And what is true is that with any kind of surgical procedure, there will be scars. And where possible, I personally try to make scars discreet and difficult to see. And that can involve hiding the scars behind your ear, hiding scars along the natural curves of the cartilage of the ear and into the hair. Scars that can be made more in a visible place, well, they can be more noticeable. And what takes a great deal of the time in facelift surgery is hiding those scars. Now, for me to do a facelift procedure generally will take between 4 to 5 hours on average. And a third of that time is taken in meticulously looking after the scars and hiding the scars where possible. Now, no scars are invisible, but by hiding the scars behind the ear and around the contours of the cartilage of the ear, they can be relatively discreet and difficult to see even 6 weeks after the surgery. With scars, there are measures that can be taken to enhance healing after the surgery, and this can involve the use of certain cosmeceutical products that enhance healing and reduce the formation of scar tissue. Now, it is fair to say that less than 1% of the population can have issues with scarring, conditions such as keloid scarring. And sometimes we can have clues for this in where there have been injuries or surgeries elsewhere in the body, and we can look at those areas and predetermine what the risk is for keloid scarring with facelift surgery. If there is an issue in terms of healing and exaggerated scars, there are measures that can be taken, such as the use of anti-inflammatory medicines to reduce the scarring in those specific areas. And so, although scarring is best avoided where possible, there are measures that can be taken to improve scarring if it should occur. I hope this has been useful for you. Thank you for your question.